Hello, this presentation is on Health Insurance Portability and Accountability Act of 1996, also known as Hipaa. A major concern for both patients and healthcare providers is the protection of private health information. Private health information includes any details that could identify a particular patient, such as a name, phone number, hospital medical record number, diagnosis, or Social Security number. The U.S. Department of Health and Human Services issued a set of privacy rules called the Health Insurance Portability and Accountability Act of 1996, commonly referred to as Hipaa. It sets rules to limits to who may have access to a patient's health information, whether that information is in written, oral, or electronic form. It also gives patients the right to review their own health records, making corrections to their records, and receive notification of how their information may have been used or shared. The Health Insurance Technology for Economic and Clinical Health Act added more strength to the existing HIPAA protection of patients' medical information. Nurses should use many of the same rules for protecting patient privacy that were practiced before the addition of electronic records. Information about a patient should not be discussed in public areas such as hospital cafeterias or elevators. Any paper documents that may contain protected health information should be placed in designated shred bins. Newer considerations for nurses include not sharing passwords, not leaving a computer screen with protected health information unattended, and not posting any patient information on public social networks such as Facebook, Instagram, or Twitter. Common sense habits related to confidentiality must be practiced. In the days of paper charge, it may have been possible to obtain unauthorized access to a neighbor's or celebrity's chart without being detected. Now it is very easy to ascertain electronically each time a patient's chart is accessed and by whom. A nurse who improperly accesses a patient's chart could face loss of employment and a possible fine, loss of licensure, and/or legal action. Despite the move to electronic health records, medical fraud still occurs. The cost to Medicare and Medicaid is roughly $98 billion, and the cost to the entire healthcare system is around $272 billion per year. Fraud occurs through the charging of false visits, overbilling for services, prescription fraud, and unnecessary ambulance transports. To combat this, CMS is enlisting patients to scrutinize their bills for charges that don't seem accurate. Nurses should educate patients about these scams and how to protect themselves. Social media in the workplace. In 2016, almost 2 billion people worldwide use some form of social media, with Facebook being the most common. In a study conducted in 2011, 87% of physicians surveyed reported personal use of social media, and 67% reported professional use. Social networking can pose several ethical dilemmas for healthcare providers. Some employers have demanded access to their employees' social media accounts or have monitored employees' activities. As of 2016, over a dozen states had made it illegal for employers to require employees to provide passwords or access to an employee's social media accounts, and several other states have legislation pending. The other challenge in the workplace is navigating the use of social media by providers. The National Council of State Boards of Nursing has developed a set of media guidelines for nurses. They caution that inappropriate posts by nurses to social media can result in licensure and legal repercussions. Sharing any information at all about patients with your friends on social media is inappropriate and violates HIPAA and the Nursing Code of Ethics. Many institutions have developed policies to guide staff and providers on whether or not they can friend patients on Facebook. Many providers do not friend patients on personal Facebook, as this generally is a less professional site and reserved for their friends and family. However, social media is a powerful tool and a great way to communicate with the millennial generation. So many institutions and provider practices set up institutional Facebook, Twitter, Instagram, Pinterest, and Google Plus sites where they can distribute general information to patients. They can provide educational videos on subjects such as diabetes, remind patients to get flu shots, or disseminate other important information. Social media is not the only electronic tool presenting challenges for providers. Some hospitals and healthcare offices use emails and text messages to notify physicians about a patient's status. If this information is not encrypted and includes a patient's name or other identifying factors, it may be classified as a Hipaa violation. To mitigate this risk, employers now require the use of mobile security services that protect devices at both the device and application levels, so that if a device is lost or stolen, access to the sensitive data can be disabled. Text messages can also be set to delete after having been read. Quality assurance. On the surface, the implementation of EHRs would seem likely to automatically improve the quality of patient care. It has the potential to do that, but an EHR is just a tool, and outcomes of care depend in part on how the tool is used. Accuracy. Recording accurate patient health information is vital, whether the nurse is using a paper or an electronic system. First encounters with an electronic charting system involve a learning curve that increases the chance of errors in recording data that will be left in the patient's chart. For example, someone who is new to the system may not know how to remove a blood pressure reading that is 225/124 because the arterial line transducer was on the floor, or how to mark that reading as faulty data. In many charting systems, more than one chart may be open at the same time, so entering information on the wrong chart may be easy. An accidental click of the mouse on the wrong medication can cause the provider who is not paying attention to order or give the wrong medication. Device interrogation, which automatically enters patient vital signs into the EHR, is possible in some systems. This has increased in use and is found not only in intensive care units, but also in telemetry, obstetrics, and even general care units. Device interrogation allows real-time accurate data to be recorded in the patient's chart directly from the device. It allows a nurse to more quickly analyze and interpret the data and make adjustments to the plan of care based on the most current information. In one study of ICU patients, 95% of vital signs were recorded at least once per hour, and clinicians validated most of the data within 15 minutes of it being recorded. As EHRs evolve, more departments are likely to use device interrogation. Some EHR systems use templates and cut and paste features designed to promote efficiency. This leads to critical thinking. The fact that EHR is merely a tool cannot be overemphasized. As with paper charting, the patient and not the record should have first priority in the nurse's attention. Although it may be difficult when electronic records are used, nurses must learn to focus their attention on the patient and not the computer. Employers should give nurses adequate training on the use of their electronic system and provide mentors to help decrease the stress of adding one more activity to the nurse's already busy workload. Clinical decision support systems are a type of artificial intelligence that analyzes data and provides information about evidence-based practices. These systems can help improve patient safety and quality of care. However, they cannot take the place of sound nursing judgment. The use of clinical decision support systems in nursing practice is described further in the Clinical Decision Support Systems module. Uniform language. For greater efficiency, nurses should use uniform language in their documentation. Uniform nursing diagnoses, along with uniform descriptors of nursing interventions and outcomes, can help clarify care of the patient not only to other nurses, but to other disciplines as well. Some documentation within an electronic record may have only standardized descriptors available for the end user. The use of uniform language also aids in nursing research.